Developing type 2 diabetes is a world problem. Therefore, watching what one eats, monitoring one's own blood sugar, and having a healthier lifestyle can help prevent type 2 diabetes.
Know anybody with type 2 diabetes?
Yes, my dad has type 2 diabetes.
Do you know anybody with type 2 diabetes?
Yeah, my grandma had it. She passed away because of it.
Do you know anybody with type 2 diabetes?
Yeah, my uncle has it.
Do you know anybody with type 2 diabetes?
Yeah, I think my aunt and uncle have it.
They said that you were joining 30 million other people that have type 2 diabetes, and you're going to have to change your life habits because that's probably one of the main reasons. It's like, and that's sort of the way I feel about it too. It's like a disease you don't really have to have if you change how you eat and exercise and weight control, because it's very, very related to weight.
Eating unhealthy food and not exercising enough can increase your risk of developing type 2 diabetes.
My name is Scott Duffney. Type 2 diabetes,
Okay.
which indicates that it came on during my life, not I wasn't born with.
How do you manage your diabetes? Like, what do you do and check blood pressure?
I manage it I used to be just on diet, and then I ended up getting complications that I had to be on steroids, and then I ended up on insulin. So I'm on insulin. I'm on a short acting and a long acting insulin at night.
My doctor talks about that maybe you're going to have to take insulin, which would be like injections.
So you've never done insulin?
No, I've never.
But if it worsens, then you would do insulin?
Yeah, that would be the next step.
Yeah.
Yeah.
Okay.
We are at our local grocery store, Colburn's, and we're looking into finding the prices for healthy foods and non-healthy foods. As you can see, this small variety pack of berries, $7.98. Not good. Look at these jelly bean prices. $1.05. Compared to the berries, they're $6 less. Why would a parent not buy these instead of the berries?
Actually, I did a lot of it with walking and kind of changing my eating habits, and I lost about 20 or 30 pounds in just a few months, and my numbers went right to very acceptable. But those things are hard to maintain as far as because they're big life changes.
And did you stray away from a certain type or certain foods?
Yeah, I have to watch my carbs really good. And carbs and, well, naturally I don't eat much sweets, but I do have it once in a while. But that's about it, watching my carbs.
Well, one of the things that I used to eat a lot of, and I don't anymore, is any kind of juice. Because juice can, orange juice, apple juice, they bring the sugar a little faster. Your body processes faster or something, and it gets into your blood and can elevate your blood sugars quickly.
How do you manage your diabetes? Like, what do you do, like, daily?
Well, I rely on a medication called metformin, and I take, I think there are 500 milligram tablets, and I take 2 of those 2 times a day, so that's 4 of those every day. And I usually take them in the morning and then in the evening.
Some say diabetes is not an issue, when actually 1.4 million Americans are diagnosed with diabetes every year.
As you can see, this stand right here is a very healthy, good choice that they offer at Coborn's, and I think more stores should have it in there.
When I first was diagnosed, I went to diabetes school.
Really?
And, oh yeah, they have a lot of sessions and stuff. And
Just to like inform you what's going on.
right, it's like in the evening at the Park Nicollet has a whole major tower that's the diabetes center. And
Oh.
you go in there and you go into a class, and they show you how to use the testing equipment, and they tell you what to eat and how to eat and stuff. And so, yeah. But even now, like I go to see a nutritionist because if you just have even a smaller weight loss, it really affects your numbers pretty quickly. So it's it can be a very helpful thing, and the medicine is fine, but it's kind of a disease you can not have to suffer with if you take the right steps.
Yeah.
Yeah, I think if I never would have had extra weight, I probably wouldn't have had any type 2 diabetes. No, it's kind of scary because there's this possibility that maybe you know what you're going to die from. It's spooky.
Diabetes.